today.
Hi, thank you for having me here.
No problem. I just want to ask you a couple questions, see if you fit within our company and maybe what we're looking for in our facility for this internship.
Okay.
First of all, I'd really like for you to tell me about yourself.
I've been studying recreational therapy for about 2 years, and I have been doing volunteering at Rocky Horse Ranch for about a year and 60 approximate clear air exploration hours.
Wow, that's a lot of activity within our discipline, and that says a lot about you, and seems like you're pretty passionate.
Oh yeah, I love being at the ranch.
Well, wonderful. What do you actually do at the Rocky Horse Ranch?
I'm a sidewalker, so my job is to primarily make sure that the client stays on the horse and also provide therapy by either holding rings or playing ball with the client on the horse.
Wonderful. Okay. So, what interests you about this recreational therapy internship?
I really want to have a diverse set of populations. I want to see a lot of different diagnoses, and I believe I can get that here.
What do you actually know about our agency so far?
You guys have about 90 beds, and you primarily work with spinal cord injuries and stroke patients.
Excellent. Could you do me a favor and describe your worst boss or coworker that you've dealt with in the past, and maybe explain a little bit why?
I would definitely say I had a really bad coworker. He would constantly call out late, or he would show up late. And I just think that's really disrespectful, especially when we're camp counselors and we have to put the kids first. So I don't know what was going on with his personal life, but I just thought it was very disrespectful.
Excellent. Well, how about you go into me a little bit about your experience with the Rocky Horse Ranch, and you mentioned several 60-plus hours in the field. Could you describe maybe another one of your past practicing experiences for me?
I did about 30 hours at Wake Med, and there I worked both inpatient rehab and with their Club Reach, which is held on Monday, Wednesdays, and Fridays. And it's a day treatment program that they provide.
Club Reach, I think I've heard of that program. Quite reputable. What experiences do you have actually doing recreational therapy interventions?
Well, I've been preparing for my internship by being at the ranch every day and just seeing what the therapists do in terms of interventions.
Have you had any chances to facilitate or maybe lead an intervention?
No, but I will be soon.
That's wonderful. Only a few more questions for you. You've given quite some great information. Could you tell me a little bit about your strengths?
I'm definitely dependable and organized, and I like to take the initiative on things. Oftentimes I would show up early to work just to get myself prepared, pick the different games for the kids, and make sure I knew how to play those with them when the time came to do them.
Sounds like you prepare ahead of time, and it sounds like you're pretty successful whenever you do these things. Could you maybe share with me a couple of your weaknesses? Maybe two of your weaknesses.
Well, I would say that my one weakness is making sure that I have professional boundaries with people. Sometimes I will occasionally ask them a question that could be taken the wrong way. So currently I'm trying to focus on what I say before I say it, as well as consider if a response needs a comment from me. And then my other weakness would just be maybe I talk too much, and I'm working on that also by making sure when I talk to anybody, I try and do half and half. And I know that being in therapy, we always have to listen more than talk. So
that sounds like you're very well aware of these things that sound to me like weaknesses, but you seem to be able to turn them quite into a positive. So maybe you could tell me about a time when you had to take initiative, maybe in a group setting somewhere.
Well, like I said earlier, I have previously worked for the City of Raleigh, and I was assistant camp director, and oftentimes I would come up 30 minutes early to work to pick up the games and make sure I knew how to play the games, and then ask any questions about the day that I would to our director.
Wow. Sounds like a director would be quite lucky to have you with the program. I actually like to share a couple of maybe scenarios with you and see what you think you might want to do in the situation presented.
Okay.
Firstly, you would have You've been scheduled to lead, along with, of course, a LRT or CTRS, aquatic therapy on the psychiatric unit. You're in week 8 of your internship, and you have 6 patients scheduled to attend, and they are dressed and ready for the day room for 10 minutes prior to the session. You have checked the patient's chart, and they all have appropriate orders to attend. What should you do next?
I should give them a little introduction as to what they're going to be doing and why, to how they're going to relate to their goals, and then just kind of give them a debriefing on what they'll be doing.
Excellent. Scenario number 2 for you. Your 6 patients are ages 18, 27, 54, 60, 33, 43, and they all vary male to female. You have worked with the 18-year-old male for 2.5 weeks prior to this session. He has a limited support system at home. You have built a strong rapport with the 18-year-old male by this point. In aquatic therapy, the 18-year-old male discloses to you that he is discharging the next 2 days. You congratulate him. He then asks you if you want to hang out friendly, or he is coming on to you. It doesn't matter, however you take this. But once that he is discharged, how should you proceed with the situation?
Well, again, I would congratulate him, and I would apologize to him and tell him that I'm not allowed to give out my personal contact information, but I wish him good luck.
Sounds pretty responsible, and like you didn't want to maybe set him back, maybe. You're in week 4 of your internship and are observing a session. A rehab patient starts to seize. What should you do as an intern?
I would definitely inform my closest supervisor who's in the room, and then make sure that the client is okay and make sure that their head is not going to hit anything.
Could you maybe describe your work ethic for me?
Very dependable, and I really care about what it is that I'm focused on.
So when you describe caring about what you're focused on, so you have another motivation, something that drives you. Could you maybe explain a little bit about your motivation?
Yes, I can actually give you an example of one. When I was working at the ranch, there was a client that I'd been working with for a semester, and I came back the second semester. I started working on him, trying to remember my name, and in a couple of weeks, he finally was able to tell me what my name was without me having to cue him. And seeing the clients progress just really motivates me to want to be the best therapist that I can be.
Wonderful. Sounds like you're inspired to really make a difference. That's what we're looking for in this field. We need more of that. So can you tell me a little bit about your ability to maybe work under pressure in any stressful situation?
Whenever it comes to stressful situations, I just try and take it one thing at a time. Focus on what needs my attention first, and put everything else I'm thinking about kind of on the back burner.
Maybe you can give me a little bit more of an explanation about how you would be an asset to this agency in particular.
I think I provide a lot of different skills that maybe some of the other potential interns might not have. I ballroom dance, and I could potentially lead maybe 1 or 2 introductory lessons for that.
Well, it'll definitely help you stand out. I've not had one interviewee that is a ballroom dancer. Why should I accept you as an intern over someone else who is applying?
Well, like I said, I'm very dependable and organized. And I took the initiative, and as well, I have a very amount of different skills.
Okay. Now, what if you had to respond to a crisis? What would you do first, and then why? Just follow like a sequential step for me.
Well, it really kind of depends on the crisis, but the first thing is always to notify somebody, whatever the crisis may be, and then make sure whoever is involved is okay.
Sounds like you are pretty responsible and have a cool head on your shoulders when it comes to a stressful situation. Now, what qualities do you look for in a supervisor?
I definitely don't want to be intimidated by you. I want to make sure that I can come to you with questions or comments and not be afraid to tell you or ask you something.
Like we all hope for that in a good supervisor, and hopefully you'll find something that will fit your interests. Now, do you have any questions for me?
Yes, we have to have a certain amount of hours, and I just want to know how that would be managed in terms of a schedule, of a weekly schedule, and then it also Also,
for
in
a
terms
weekly
of
schedule, I'm sorry, I should answer your question. For a weekly schedule, you would be expected to perform at least 20 hours every week in our facility, possibly from 9 to 5, 4 days a week. We could probably do something like that.
Mhm.
Do you have any more questions?
Yes, when do you think I might be hearing back from you guys if you decide that we're a good fit and I could work with you?
Well, we try to give our interns a good heads up to make sure if they're in the market at any other facilities and if we want you to join our team. We give you about a week to decide and let us know so we can find a good fit for you.
Okay.
Anything else?
No, I think that's about it.
All right. Well, I appreciate your time. Thank you for coming in.
Thank you so much. I really appreciate it.
All right, good luck. Have a great day.